Hi there, my name is Simon Ruth. I am the CEO of Thorne Harbour Health, and I'm coming to you live from the Positive Living Centre in South Yarra. We find ourselves in all too familiar circumstances once again due to the COVID-19 pandemic. Planning an event like this takes a lot of time, and a decision was made very early on to protect our community by holding another virtual event. So let's get the show started, and I hope you enjoy the 29th Annual Keith Harbour Address and our awards ceremony as part of this year's AGM.
Hello, my name's Tim Dyke. I'm a board member of Thorne Harbour Health and the Vice President. The Keith Harbour Address commemorates a remarkable man, a man living with HIV. Keith was a pioneering leader who worked for the community from high-level political action to grassroots activism. He became president of our organisation in 1987 and also held executive positions in the Australian Federation of AIDS Organisations in 1990 and 91. We have acknowledged the achievements and commitment of two of our founders by renaming the organisation as Thorne Harbour Health. Keith coined the phrase, "talk with us, not about us," to help change the view he felt was held by some service providers and that positive people and the gay community should be passive recipients of services rather than actively involved in their care and support planning. So to give the Keith Harbour Address today, we're thrilled to have Kit, also known as Christopher Fairley AO, to deliver the address. Just like Keith, Kit has also changed perceptions. Kit is the director of the Melbourne Sexual Health Centre and Professor of Public Health at Monash University. He's changed thinking in sexual health, demonstrating that papillomavirus infections were sexually transmitted and that lack of access to healthcare was a major driver of sexually transmitted infection epidemics, as evidenced in Indigenous Australian communities. His principal research interests are the public health control of sexually transmitted diseases and the effectiveness of clinical services. So please join me in welcoming Kit to deliver this year's Keith Harbour Address that he's interestingly titled, "It Really Matters Whose Fault It Is That Bob Got Syphilis." Over to you, Kit.
Great. Well, look, thank you very much indeed. I was asked to talk about myself, but I'll be completely honest and say I'm far too boring to talk about. So I'm going to talk about some of the work that I've done and some of the ideas that have come from some of these sort of presentations. So bear with me a second while I just share the screen. Okay, so I'm going to talk today about whose fault it was Bob got syphilis. And I hope at the end of this you'll appreciate that the answer to that question is very important. So Bob was a 33-year-old married man. He'd been married for about 5 years and they were celebrating their 5th wedding anniversary in Darwin when lightning struck. Just in case you didn't know, lightning's actually very dangerous. It kills about 24,000 people a year. And I have been far too flippant being outside when there's lightning. Now, Bob survived, but his husband died. And it was a year later when Bob's sister introduced him to a man at a dinner party. And after their 3rd date, they had sex and the condom broke. Now, this was Bob's first sexual partner since his husband had died. And unfortunately, he developed a primary syphilitic chancre. And the question I have for you to think about is, who is to blame? Whose fault was it that Bob got syphilis? So if you go back to the ask some politicians, and these are some of my least favourite politicians, I have to say, they would tell you that it's about individual responsibility, it's about your personal choices, and therefore the person to blame for things that happen to you is you. Individual responsibility is the idea that human beings choose, instigate, or otherwise cause their own actions. So these two people would have you believe that it's Bob's fault. And indeed, if you go back about 100 years, that was the thinking of some of the individuals. So this is a public health campaign. And the doctor is handing to the patient something, and the caption is, "Don't fool yourself, you're to blame. You should have shown some restraint. You're weak." Whose fault is it that Bob got syphilis is all about this blame and being responsible? Now, I'll put to you that it was okay 100 years ago, probably never was okay, but it was acceptable 100 years ago. But it's a very destructive and emotional comment. And I think we should frame it differently in the 21st century, even though we have some politicians whose thinking might be 100 years old. So if we ask a different question, we said, what are the causes for why Bob got syphilis? Was it because he had sex with someone? Or was it because the person with whom he had sex had syphilis? Because, of course, if that person didn't have syphilis, he wouldn't have caught syphilis. Now, just think about the night that Bob got syphilis. In Melbourne that night, about 500 men had sex with new male partners. And only 3 of those men caught syphilis. So the risk was probably about 1 in 150 or so. In Melbourne that same night, 16,000 heterosexuals had a new sexual partner. Not one of them caught syphilis, because the risk is so much lower, because the proportion of people with syphilis in the heterosexual population is so much lower. So the risk that a gay man catches syphilis when he has sex with a new partner is 330 times higher than it is for a heterosexual. Same sex, same new partner, but the risk is much, much higher. So one of the reasons that Bob caught syphilis was because he was a gay man. That was not a choice. You can't take individual responsibility for that particular decision, which is embedded in something about him. So let's compare 2 different years. Let's say it was 2003 and not 2019. Now, in Melbourne in 2003, 500 men would have had sex with other men, and only 1 in 7, less than 1, would have caught syphilis. But in 2019, as I told you, about 3 caught syphilis. So the risk of catching syphilis was 23 times higher in 2019 than 2003. You'll see there on the graph. So one reason that he got syphilis was because there's lots more syphilis now than there was then. It wasn't his choice to be born in a particular year. So he was sexually active in 2019 rather than 2003. So this is all about what determines the risk of a sexually transmitted infection in a population. Because if we know what causes a high rate of syphilis in a population, then we'll have some insight into the cause for Bob getting syphilis. Now, people think people catch sexually transmitted infections, or indeed there's lots of infections in a population because people have lots of sexual partners. Well, actually, the single most powerful thing that determines the incidence of a sexually transmitted infection in a population is healthcare and access to healthcare and treatment for those infections. So if you look at the dotted line, which is women, take it as code for heterosexuals, it never recovered after penicillin. It virtually hasn't come off a flat line. But you'll see in gay men it's gone up and then down with HIV and up again more recently. So penicillin is the single most powerful predictor of the incidence of a sexually transmitted infection. Now that's determined by the reproductive rate. When I first spoke about this, no one knew what that was, but now people do because of COVID. So in the context of sexually transmitted infections, it's determined by the probability of transmission per partnership. Condoms have an effect on that, the rate of partner change, and the duration of infectiousness, which is all about access to healthcare. And if that number is less than 1, the infections die out, as they appear to have done in heterosexuals largely. And if it's greater than 1, you get an epidemic. So if you just imagine, for example, a plane load of people with gonorrhea flying into Melbourne, you'll see that what happens, the infectious is the purple line. Doesn't matter how many plane loads of people with gonorrhea you fly into Melbourne in 2005, not the case now, but in 2005, they just all went away because the reproductive rate was less than 1. But you only had to introduce one person with gonorrhea into Indigenous communities that have limited access to healthcare in 2003, and you got an epidemic occurring. So it's which of these factors are different that matter. So why then is the reproductive rate high in gay men, and why are STIs rising in gay men? Well, let's talk about condom use and sexual practices. Well, it is true that with a more effective HIV prevention tool, PrEP, than condoms, and one that allows intimacy and pleasure more than condoms do, you are seeing a reduction in condoms. But bear in mind, the vast majority of the increase in syphilis occurred before there was any measurable change in condom use in gay men. So the green line is condom use always for anal sex with casual partners, which really hadn't materially changed despite huge increases in syphilis. So decreasing rates of condom use are not the reason for the high rate of syphilis. And indeed, condom use in heterosexuals is less than it is in gay men. And it's very difficult in public health to fight pleasure. So this is a measure of ranking of pleasure amongst people born in different countries. It's a study done in Japan, so it's people who are born in different countries but living in Japan. And you'll see that people rank sex as the #1 pleasurable activity. Now in Japan, it's not ranked #1, but remember, the food in Japan is a lot better than the food in some other countries. I'll leave that slide out. So you might talk about drug use. So say that drug use is going up, but in fact it's not. This is the Gay Periodic Survey again, and showing that in fact amphetamine, speed, or crystal meth use has actually been decreasing, not increasing over time. So we can't blame drug use as the cause. Let's talk about the rate of partner change. So there is no data to suggest, I should say there is data to suggest there is no increase in the number of sexual partners in the people preceding the 2009 event when Bob caught syphilis. But there is some changes in mixing patterns. That's occurred just simply because of technology. People find partners more using dating apps than they did in the past. That pushes high-risk people together. When you push two high-risk groups together, you get more transmission than you do if they're evenly spread in the population. So dating apps were not a choice, they just appeared on the scene. It's true that gay men do have more sexual partners than heterosexuals. But it's also true there's a lot of drivers for that happening, and one of those is stigma. So stigma has a very negative effect on sexual risk. So it increases sexual risky behaviour by 3 times, reduces condom use, increases numbers of partners, and increases number of anonymous partners, which prevent partner notification and therefore control at a population level, increases substance abuse. But stigma has lots of very negative issues as well. Now, I can't believe that in 2021, when I'm talking to you, organisations that receive public money for funding, i.e. some religious schools, can, under the current legal system, sack someone for being gay. Stigma also, apart from limiting people's income and job opportunities, it limits their access to healthcare, it has poor mental health and coping skills, it affects the success of long-term relationships, which therefore increase the chance of acquiring infections and increases anonymous partners. And if you haven't seen this movie, I strongly suggest you do, particularly if you like feel-good movies. So Simon's a young man coming out in his final year at school. And it's a bit like Sleepless in Seattle. And the woman there in the top left is crying uncontrollably because her daughter is coming out as being straight. And that's the dream that Simon had. He had a dream that why do gay people have to come out as being gay? Why don't straight people have to come out as being straight? But you can, of course, do something about stigma, and you can affect all those other things. So if you put in place interventions to reduce stigma, the comfort with being gay goes up, as opposed to control sites where it goes down. So there's no evidence that in Australia, increasing numbers of people are having more sexual partners. There is evidence of higher risk mixing, but that's not a choice. That's a feature of new technology. And stigma greatly increases STI risk. You may well ask, why not just increase condom use or reduce partner number? It seems sort of obvious. Bear in mind, though, I've told you changing people's behaviour in the context of pleasure is a very big challenge. And in short, you can't reduce partner number. It's not possible. People have tried to. There's the same issues associated with trying to get people to lose weight. You can increase condom use a bit, but virtually not beyond 12 months after intervention. It's expensive and it's very hard to sustain. But access to healthcare, remember, and duration of infectiousness are very powerful STI control measures. We've seen this graph before, but just look again at the magnitude of that effect of introducing healthcare in a population and the effect it's had on syphilis. Now, the reason that penicillin is so potent against the population level of syphilis is because it reduces the duration of infectiousness enormously. So if you make sure your population recognise the symptoms of primary syphilis and come in and get treated, in other words, you've got a system that provides them with accessible healthcare, the infection may be infectious for only 12 days. In contrast, if they miss the primary infection, a person doesn't recognise the symptoms, or they can't get access to healthcare, or it's too expensive, or they feel stigmatised, or for whatever reason, it might last half a year. And if the symptoms of secondary syphilis, or again, access to healthcare is limited, it'll go perhaps for a year. So how are we going to provide accessible healthcare? So you can try and infections like happened with the COVID epidemic, but virtually nothing like that works in the long term. Certainly, this is a picture of the train I take to work, and there's the Melbourne Central train station at 5:02 on a Friday afternoon. So there was some reduction in STI risk associated with COVID, but it bounced back very quickly. But let's just focus on the pre-COVID era, because that's when this talk was prepared and described. So we're talking about Bob in the pre-COVID era. So despite having a fabulous group of staff with whom I work and increasing the efficiency of the service very dramatically by computerisation and other means, and getting up towards 60,000 individuals being seen, it was impossible. The service was overrun. There's a blown up picture of us celebrating Marriage Equality Day. And what happened was that the waiting time doubled and doubled, and not infrequently in those days, you'd call out to someone in the waiting room, but they'd gone because they couldn't wait any longer. And this is indeed what our waiting room looked like. The red there are people who waited more than an hour, the yellow more than half an hour, and you see it just completely filled the screen, and the waiting room became huge. 3 consecutive days at 1 o'clock in the afternoon. We had to put these sort of signs on the website. We're experiencing long delay. If you could possibly go somewhere else, please do. And on some occasions we had to say, The waiting room is full. We can't see any more. You can't come in. Melbourne has a single sexual health service. Sydney has 10 in the city and another 20 or so in the country. There's the ones dotted around the country. So infectious syphilis increased. Remember, most of this increase is occurring before the changes I showed you in condom use associated with PrEP. And so we need to do something about that. The state government has put in place a review of sexual health services, and more recently has developed a hub and spoke model. So we have now 6 GP partners working in the state. At the moment, they're not seeing a large number of people, but the hope is that we'll get quite a lot of spokes and increase the number over time, and it'll provide a very effective and more accessible health service than currently exists. But there are some consequences of inadequate health services. One of them is breakaway STI control, because of course, the more infections you get, the more delay there is if there's in just one existing service. And you see how Melbourne's syphilis rate broke away from Sydney. This is the rate. In Melbourne, it was 50% higher in 2017 than it was in Sydney, despite there being more gay men in Sydney than there are in Melbourne. And in fact, that's led to an increase in syphilis in women in Victoria ahead of New South Wales. Now, why it's occurring in heterosexuals, we don't know yet, but we do know the consequences of that happening is the reappearance after nearly 20 years of congenital syphilis cases that weren't seen for a very long time. Mostly they're in the metropolitan area, but also in some country areas as well. Now, you might well ask, well, isn't that just something that happens? But in fact, it's probably not. If you look at Denmark, which has a better STI health system, you'll see they saw increasing cases in men and smaller mark cases in women. They increased access to services and at least at this point seem to have obtained some adequate control. That's not true for all countries in the EU, but it's true for some. And also the world is growing up a bit. There's other changes that are happening in the world at the same time. So this is 2002, 2008, 2014 and 2018. And it is the school survey. And the survey is, are you only attracted to individuals of the opposite sex? So boys and girls answered this question. In 2002, it was 95-91. But in 2018, it was 67-56. So you can see that this is rapidly changing and that the people are not changing. All that's happening is they're being more honest and open about their feelings. That's likely to lead to different changes in sexual practices as well, making more urgent some of the issues I've dealt with. So there are other international comparisons that highlight the importance of access to healthcare. So I use HIV as an example. This is HIV rates in women in the US. In white women, 1 to 2. In black women, about 30. This is not because they have more sexual partners or use condoms differently. This is primarily driven by the fact that the men that these women are having sex with more commonly have HIV, more commonly have undiagnosed HIV, more commonly have untreated HIV and higher rates of sexually transmitted infections, all due to access to healthcare. The same is true for gay men in the United States. If you're a white gay man, your chance of lifetime risk of HIV is 9. If you're black, it's 50. It's not because they're having more sexual partners or using condoms differently. This is about access to healthcare. It's about access to PrEP. We know how powerful that is. Access to HIV treatment, access to HIV testing, all of those things determine population levels. I just want to clarify for a minute what I'm saying here. I'm not saying that all the rises in STIs are due to inadequate health services. I am saying that adequate health services are the single most powerful STI and HIV control measure. Inadequate services will greatly increase STIs. Stigma increases STIs and risks. You can't control partner number other than through interventions to control stigma. And condoms work, but their effect is weak, they're expensive, and they're short-lived. So I think we're entering a brave new world. We've had this reprieve of COVID, but we're going back to the pre-COVID rate now. And we're entering this when our strongest STI control strategy is not working properly. I said before, the government is opening up these other issues, but these other GP services, but we need to make sure that access to healthcare is absolutely optimal when we've got so many infections around. Now, I want to make an important analogy here, which may help people get the message that this is not about individual choice. So we love having sex and we love eating. And that's why there are 7 billion people on the planet. So let's just say Bob didn't have syphilis. Let's say Bob's overweight. Now, some of the previous politicians I've shown you might say, Bob is overweight because he couldn't stop eating. He needs to take personal responsibility for his appetite. It's his fault he's overweight. Well, I'll put to you that that is a mean, simplistic, and incredibly ignorant view. This is 2 birth cohorts, one at the age of 18 in 1995 and one at the age of 18 in 2007. And they're 5-year cohorts on the bottom and the proportion of people who are overweight or obese. Now look how that's changed. It's gone from 20% when those people were 18 in 1995 to nearly 50% in 2007. Is it really plausible that these individuals of 18, born in different times, are so much weaker than the other ones, and that's why they're overweight? Or is it plausible that the Japanese, which rank 185th in the world for obesity, are so much stronger than the Americans that rank 12th? Is that really the case? Or is it that people live in obesogenic environments and that if you want to change obesity, you don't go to someone you should eat less, because let me tell you, it won't work. You intervene at schools about healthy eating. You regulate junk food advertising. You put a sugar tax on. When you do that, it works. So people don't choose to live in an obesogenic environment. Governments create them or allow them to be created. People don't choose to live in an environment with a high incidence of sexually transmitted infection. Government neglect can cause them. And there are huge differences in the rates of STIs by different countries with similar GDP, showing it's public policy that matters. Now, the public need to understand this, not only because it's the right thing to do and because it allows them to have an empathic view of individuals who might acquire something or be overweight. But if they don't understand it, then guess what? Clinical services don't get funded because people think it's their fault. If clinical services don't get funded, the public get sexually transmitted infections. So the public need to say to governments, protect me by funding STI and HIV services properly. So whose fault was it that Bob got syphilis? Blame and fault have absolutely no place in any discussion about any of this ever. the reason that Bob got syphilis was not because Bob had sex with someone, but because he had sex with someone who had syphilis. But perhaps we're responsible for not telling people loudly enough that that's what we want. But I'm going to tell you one thing that's absolutely certain. It was not Bob's fault he got syphilis. Thanks for listening.
Thanks, Kit. That brings a lot of interesting questions, I'm sure, to people's minds. What element of the health service is most critical in controlling STIs like syphilis? Is it the testing, the proper detection of physical symptoms, or the treatments with, say, penicillin?
I'm going to separate it as there's screening and there's access to health service. So you raised a number of very important bits of information that are critical to this. So the population need to know what symptoms are sexually transmitted. So that's very important. Then they need to know where to go. Then they need to be able to find the place to go to. And that place needs to be welcoming and warm and friendly and accepting and do all of the right things. So it's really that you had to choose between that and screening. This is much more important. So accessible STIs for people with symptoms of sexually transmitted infections really matter. Now, if I can use an example. So one reason that I think men have sex with men get more syphilis than heterosexuals is because some of the syphilitic lesions are hidden from sight, just as a nature of the sex. So we know, for example, men who top get primarily syphilis on the penis, and most of them present with primary syphilis. But men who bottom only never present with primary syphilis and present with secondary syphilis. So some things you can't change. That pushes up the reproductive rate. But the key thing is, if you get symptoms, go somewhere and get checked out. But I can understand people won't want to wait 3 hours to be seen. They will walk away in that circumstance. And it's probably almost more important than for heterosexuals who are not as good at looking after their sexual health as gay men are. They're much better at coming to health services than heterosexual men are, at least.
Well, thanks, Kit, for that. I really appreciate your enthusiasm for your topic, and I hope that Thorne Harbour can contribute to this advocacy for sexual health services, but in Victoria and in South Australia as well, where we're also active. So thank you very much.
It's been my pleasure. I wish you the best.
So every year we hand out our Thorne Harbour Health Awards and our Life memberships. Our Life memberships acknowledge members' commitment to our organisation, and our awards acknowledge community members' commitment to our vision and mission. A healthy future for all sex, sexuality and gender diverse communities, a future without HIV, where all people live with dignity and well-being. As you can imagine, everyone getting together to give out awards was a tall order, so we have pre-filmed these. Let's take a look at what has unfolded.
Quiet on set.
Good afternoon, my name is Bruce Weston, board member of Thorne Harbour Health. I'm here to present a Special Services Award to Abdurrahman Kedamish. Special Services Awards are about recognising individuals, organisations, groups or projects that are making a difference in Thorne Harbour Health, the LGBTI community and/or the broader community. These awards are an opportunity for Thorne Harbour Health to say thank you to those who contribute, develop and improve in their profession, chosen field or endeavour, our mission and objectives. The categories for Special Services Awards include community services, research, volunteering and community development. Abdurrahman came to Australia in 2019 to study and to experience Australian life. For Buddy, volunteering has always been about the community. Back in Egypt, he volunteered in his local underground LGBTI support groups and at Islamic holy events distributing food. Since coming to Australia, Abdurrahman has immersed himself in volunteering to support Melbourne's LGBTI community. Although COVID-19 presented many challenges for Abdurrahman as an international student, he has taken the time to support many of Victorian's key LGBTI organisations, undertaking a variety of roles including volunteering for Midsummer, the Victorian Pride Centre, Inclusion Melbourne and the Office of the Public Advocate. For Thorne Harbour, Booty has volunteered in administration, the Positive Living Centre, Outreach and Rainbow Connections, once again helping to distribute food to those who need it most. Most recently, Booty has appeared in Thorne Harbour Health promotional videos, delivering vaccination and COVID health information in Arabic. In a short space of time, he has made a big impact to the volunteer program and embodies our organisational values of leadership, diversity, inclusion, justice, courage and optimism. Congratulations to Budi, all the best.
Hello, my name is Abdurrahman, or you can call me Budi. I'm an Egyptian. I moved to Australia 2.5 years ago. Living as a gay Egyptian in Cairo made me feel depressed growing up and not seeing a future for myself, for not being able to set goals and have a family and have kids and live my true self. I had to change my identity wherever I go or whoever I talk with, depending on the people that are surrounding me, and it didn't cope well with me. So I felt that I need to move out and find a place where I can settle and build my own family and build my own self and see who I can be. When I came to Australia, I wanted to connect with different LGBT organizations because I had to do with some of this work in Cairo and underground community building, and I felt so passionate about how this helped people and how this needs for everyone, especially the youth, queer growing, and as much as it's hard, but having people around you that feel the same way made a big difference. So when I moved here, I started volunteering with Thorne Harbour, and this helped me a lot, especially during the pandemic, because 6 months in, I was in a country all by myself, have to being isolated and not knowing much people and not having lots of people around me. And volunteering through Thorne Harbour made me connect with people, have things to do every week, and although I just come and do stuff, but I meet people, I talk to them, I ask questions, they ask me about my life, and this creates bonding, and I look forward each week to having a trip.
Good afternoon.
Good afternoon.
I'm Bruce Weston, board member of Thorne Harbour Health.
I'm Abdurrahman.
Budi,
Yeah, Budi.
Well, on behalf of the organisation, we'd like to present you with a Special Services Award. It's in recognition of all your outstanding contribution to our organisation, and we're really proud of you. Congratulations.
Thank you. Wow, that's really cool.
Feel free to say anything else you might like to the camera.
Well, I mean, it means a lot, because sometimes people around me don't understand all this time I put in volunteering and all the time I give up, and they just don't get it. So this just means a lot to me, just to share that people appreciate what I do and it's just not a one-sided thing. So I'm so thankful for that. Thank you.
Congratulations.
Perfect, let's go there. Great.
Yes, okay.
Hi, I'm Peggy Curto and I'm a board member of Thorne Harbour Health. Today I'm awarding the Special Services Award. This Special Services Award is presented to Jenny Whelan. Jenny has been the constant within Oz Showbiz Cares since the early days of the HIV/AIDS epidemic. Oz Showbiz Cares Equity Fights AIDS was established to support the fight against HIV/AIDS through fundraising for organisations around Australia, including Thorne Harbour Health. As a sector, the arts community, perhaps more than any other, has been disproportionately affected by HIV, with the loss of much more of a generation of entertainers and crew. Jenny demonstrated creativity, persistence, and above all else, leadership. Jenny and her team focused on raising funds to support our work in HIV care and support health promotion and prevention. Thorne Harbour Health and many of its programs specifically, including the David Williams Fund, the Positive Living Centre and the Quilt Project, benefited directly. Over the years, Jenny has coordinated thousands of volunteers, cake stalls, trivia nights, bucket drives, and overseen the theatre fundraising whilst maintaining links with the HIV sector and the LGBTIQ community. In September, after 25 years, Oz Showbiz Cares Equity Fights AIDS raised its final curtain. With Oz Showbiz Cares calling it a day, Jenny transferred a final donation to Thorne Harbour of close to $19,000, bringing the total of donations to Thorne Harbour to close to $240,000 since her work began. Across all of the 8 AIDS councils, Oz Showbiz Cares raised a staggering $1,124,557.44. Given the changing nature of the epidemic, Oz Showbiz Cares has now formally wound up. So Jenny, after so many years, it's now time for us, on behalf of our clients and our community, to take our hats off to you and say thank you.
Hello, my name is Jenny Whelan and I'm very proud to be representing a crazy group of people called Oz Showbiz Cares Equity Fights AIDS, who over a 20-year period have raised over $1 million for HIV and AIDS related services throughout Australia. And I'm particularly proud to sit here today and talk about the $180,000 plus that we've raised for the Victorian AIDS Council over that period of time. So Oz Showbiz Cares was actually formed in Sydney by a wonderful man called Jonathan Mill, who was there from day one and right to the end. So his vision for the organisation was actually that it would, at one point in time, not exist. So we have achieved that vision now. But our motto, as we all went through, basically a lot of energy of Mickey and Judy putting on shows in barns, was to raise money, raise awareness and raise the roof. And one of those main ways that we actually raised funds was through bucket drives at theatres and through our annual production of Hats Off, a fundraising conference. Can I start that again because you're going to edit it, right? So one of the ways that we raised money...
Excuse me?
Hello! Oh my gosh, hello, how are you?
Good. My name's Peggy.
Hi Peggy.
I'm on the board at Thorne Harbour Health.
Lovely.
And we've sort of sneakily got you in here, not for what you think. We want to present you an award from the bottom of our hearts, from the community, for all the work you've done over the years. This is a Special Services Award.
Thank you so much.
Thank you so much beautiful. For you and Oz Showbiz Cares for everything you've done over such a long period of time.
Oh, thank you. So yes, thank you very much for this beautiful, beautiful award. I'm so touched. Thank you.
My name is Paul Hoffrichter. I'm a driver for the Mulgrave Group. There's a couple of us that do midweek driving for the guys, but unfortunately one of the other blokes has had to stop doing it because he refuses to be vaccinated at the moment. So I'm doing about 3 or 4 calls a week at the moment. I started volunteering with Thorne Harbour Health, as it is now, about 7.5 years ago. I saw an ad in the paper, in the newspaper, and it was a a section on health on a Saturday morning, and I never ever looked at that thing before, never. And I just happened to look at it one day, and it said that they needed people to take people to doctor's appointments and that. And if you're interested, come in, give us a ring. So I'm a carer for my wife. She's got problems with her right hip and her left knee, and she's in a wheelchair at the moment. But I had lots of time left, so I rang, and he said, "Oh, come on in." And it was a guy called Alex from PLC. And I went in there, and he's telling me all about it. And he said, "Oh, most of the people will be HIV patients. Is that a problem for you?" And I said, "Oh, I don't care what their religion is, that doesn't matter. Doesn't worry me." So I started then, and I was doing sort of 1 or 2 a week and that sort of stuff. And that was about 7 years or so ago.
So we actually have a little video for you to see.
Oh, right.
Pre-recorded for you.
My name is Neil Farrow, board member at Thorne Harbour Health. I would like to award Paul Hoffrichter our Special Service Award. Paul has been a volunteer with community support for over a decade. As a volunteer driver, Paul has provided hundreds of medical transports to ensure vulnerable people receive the care and support they need. As a member of the Mulgrave volunteer team, Paul has been integral in ensuring people living with HIV are connected to their communities through social activities and that they are living well through providing a range of individual supports. When Victoria was locking down during the COVID-19 pandemic, Paul continued providing vital transport that assisted our community to manage their health at this difficult time. He's a trusted and reliable volunteer, often making himself available at short notice to support our community. Paul's work demonstrates the volunteer spirit that has been the backbone of community support's work since the very beginning of the HIV epidemic. Congratulations, Paul. Very well deserved.
Oh, that's nice, thank you.
And Paul,
Yep.
as Neil just said, this is your award for outstanding contribution to the work of Thorne Harbour Health. So thank you. It doesn't go unnoticed. We appreciate it.
Oh, that's not a problem.
There's your award.
Thank you very
Well
much
done.
indeed. That's cute. That's really nice, isn't it? Now I really am blushing. Thank you so much. Oh, that's great. No, I mean, as far as that is concerned, I enjoy what I'm doing. I find that it helps these guys to a certain degree. I've made some friends out of it, so that's really great. So I really enjoy it. Thank you.
Hi, I'm Adam Bourne and I'm a member of the Board of Directors here at Thorne Harbour Health, and I'm here to present the Special Service Award. And it's with great pleasure that I can present today the award to Nathan Sene-Varathna. Nathan joined Thorne Harbour Health as a volunteer in 2015. Since this time, Nathan has played an active role in many positions, including reception duties, working bees, community support and events. More recently, Nathan has taken on the lead role in the rollout of Thorne Harbour Health's World AIDS Day app, and it is for his dedication and outstanding work that we're giving him this award. In 2020, Thorne Harbour Health was unable to hold the annual World AIDS Day street appeal for the first time in its history due to the pandemic. In response to this, the idea of a World AIDS Day phone app was thrown around. Nathan jumped at the chance to lead this. He recruited developers, wrote the Wirecast, liaised with stakeholders, set up accounts, created the graphics, beta tested the app, and much, much more. Nathan acted as the bridge between our ambitions and what we wanted the app to do. Nathan took a 12-month project and completed it in 8 weeks, saving Thorne Harbour Health tens of thousands of dollars. In 2021, Nathan has worked to deliver version 2.0 with expanded functionality. Without Nathan, this project would have remained a pipe dream.
My name is Nathan Sene-Varathna. I've been doing volunteering for Thorne Harbour Health for about 1.5 years. I was born and grew up in Sri Lanka. I've been living in Australia for about 17 years. I live with my partner Andy. Andy's an amazing person. Living with him and waking up next to him every morning is the best thing of my life. Between us, we have 3 kids. 16 years old, the oldest kid, and we got 12, 11 and 10 years oldest. I know it sounds full on, but I love every minute of it. And then in day-to-day life, basically helping them to do homework.
Nathan, sorry to interrupt you. I'm Adam Bourne. I'm a member of the Board of Directors here at Thorne Harbour Health. Yeah. And in recognition of your outstanding contribution to our organisation, it is with great pleasure I present you with a Special Service Award.
Oh my God, thank you very much.
You're most welcome.
Thank you very much. Oh my God, it's a big thing for me.
A nice surprise, I hope.
Oh my God. Yes, this is really big thing for me because I came out very recently, like 5 years ago, and I went through a lot of difficult situations, and self-affirmation was not enough for me. I wanted to do more than that. I thought if I can do something for LGBTIQA+ community, something meaningful, something I can cherish for a long time in my life. I saw Daniel was looking for someone to do receptionist role in the front desk in Thorne Harbour Health. So I applied and I got the role. And then not long after that, I heard Maria wanted somebody to do the World AIDS Day app. I raised my hand.
So congratulations to our award recipients so far. Now, because we can't see everybody here in person at the Positive Living Centre this year, we have the one and only community darling Dean Arcuri on Smith Street to see what everyone is up to. Over to you, Dean.
Why, hello everyone at Thorne Harbour. It's wonderful to see you all. Busy homosexual Dean Arcuri here, just out on the streets of Collingwood, having a wonderful time. And I thought, why not go for a walk and see if we can find some other fabulous queers and see how they're doing. Let's do it, come on. Oh, on the rainbow corner, always very nice. Oh. Look, I've spotted a homosexual in the wild. Very exciting. This is actually a coincidence, and everyone, this is my housemate. Hello, Chris. How are you?
I'm good.
Now, it's been a really interesting 18 months, hasn't it, for us all, being locked down? But other than moving in with me, what has been the most interesting experience for you in this time?
Honestly, just seeing how people are just trying to be so communal with each other, you know, trying to bring everybody up and be like community-minded and, you know, trying to...
As we've stepped out, it's absolutely been, I'm not saying we're all selfish. We've all had our moments, haven't we? But it has been interesting as we're starting to step out and move out again. People aren't rushing and people are thinking of others a lot more.
They're absolutely taking baby steps. They're, you know, it's all very, oh, I'm sorry, like, you know, trying to make other people feel comfortable as possible too. Because, you know, it's been a very stressful time. And I think, you know, people are really trying to be respectful of others, which is really good to see.
So now that you're stepping back out, what is one of the fun things that you're looking forward to doing as we come into summer and I can wear this caftan more often?
I mean, I love a good dance and I miss dancing and I can't wait until we can all dance together again. That'll be absolutely amazing. Absolutely amazing.
Well, that sounds absolutely fun. Chris, I'm going to let you keep going because it looks like you've either just come from Coles or you're heading to the gym. One of the two.
I'm absolutely going to the gym.
All right, well, you go and get your push-ups on, girl. You go get that going. Let's find some more queers in the wild. Let's do it. Oh, you're coming this way with us. Oh, look, And I see another one. I see another one as we go. Now, many of you would remember this street. Walking backwards is going to be interesting. Many of you would remember this street as the once lot. Why don't we do this? Oh my God, they're wonderful. We all remember Club 80 for various reasons. Look, it's been a different space for many of us. I can say many times. There we go. Walking has never been more interesting. And I've spotted another queer in the wild, just waiting out the front of the now no longer Club 80 location. Now, I have many memories in this building and in this doorway, but none of them are for public consumption. So instead, why don't we go and speak to this lovely queer here, just having a little bit of a fag. Hello, lovely Max, how are you?
I'm doing quite well, and yourself?
Oh, I'm doing very well. You know, I'm out and about. It's great to be able to be out and about again. Now, you have had a bit of a different experience to many of us who have been able to get out there, and we've all been double vaxxed, but you've only just recently had your second jab, haven't you?
Yeah, 2 days ago on Friday. So, you know, the last few weeks have definitely been a bit odd with people, you know, going out and about and seeing all the FOMO from all the selfies at the LED and Rainbow and all that jazz.
We're a very selfish people, queers. We really are. We do love to create as much FOMO as possible. It must have been a little bit strange, but it must also be nice to see the community opening up again.
Oh, completely. And especially so many different sectors of the arts and performance and drag, like people that haven't had the ability to really perform in front of a live audience for a very long time in person. So it's really fantastic seeing, you know, shaky cam video recordings on Facebook and things again.
I don't know what you mean. This camera's not shaking at all. I've got no idea what you're saying.
But yeah, no, it's just a really joyful time, and I'm fucking excited to get back out there and support venues again. Absolutely.
Well, it's great to be able to get back to community. We've all been locked away in our homes during winter. It's been very stressful, been very crazy. What are you looking forward to when summer hits to get out back in community?
Oh God, wearing very minimal clothing in public. I really do want to make it to Sunnyside at some point again. I miss the beach.
I was going to say, I feel like this is the most clothes I've ever seen Max wear in a very long time. This is literally the straightest I've ever seen Max look, but it's still with a touch of fashion, which makes me happy.
Thank you. It's my comfort moment. I'm like, sweatpants, but they're Adidas, right? It's still vaguely fetish.
If anyone can make it work, it's always Max. So you're looking forward to getting back out there, getting your kid off and just being in the world?
Absolutely, and dancing. God, do I miss dancing.
We all miss the dancing. How are you feeling after your second jab? Okay, you're all fine with it?
Yeah, feeling a little bit okay. There was a little bit of soreness in my arm. Nothing, just some ibuprofen couldn't fix and just multivitamins, keeping hydrated. Yeah, it's been manageable.
Well, what a lovely message to remind everyone, if you haven't gotten that second jab yet, or even your first, to go out and get vaxxed. I think it's a wonderful thing to do.
Absolutely. We've got to take care of one another at the end of the day, and there's more appointments and doses available now than ever. That was the only thing that stopped me for so long, is working full time, trying to find an appointment that fit my work schedule. Bit of a nightmare, but we got it done.
Yay, fantastic. Well, thank you, Max. I'll let you keep on hanging around Club 80, just whatever, doing what you normally, well, it's not Club 80 anymore. And someone's calling my name. Hello. Oh, it's Brett. Oh, hello, Brett from the Laird Hotel. Hi, what's going on?
I finally came to give you your bloody picture that you haven't picked up from the Men on Men Art Com.
That's right, I haven't picked up my artwork from the Men on Men Art Com.
In between whatever lockdown.
Oh, so many lockdowns, many lockdowns. Yes, so you brought me the picture. I realised I need to put the microphone there to make it work. So wonderful, Brett. Very good. While you're here, why not just answer a few questions for us, Bretty? Now, it's been very crazy for you over the past 18 months with lockdown. You must be happy to be able to open your business up again and see the community and get back into it.
Oh, absolutely. It's actually, it's really good. I'm not going to say it's amazing, fantastic. That's toxic positivity, which I learned all about recently. And it's been good. It's been really good to open and see all the people coming back in and start to actually think there's events we can do now and we won't have to postpone them or cancel them. So it's just
is there one, now we just had the Leatherman competition, but is there one event, perhaps one that you do with Thorne Harbour every year, that you're looking forward to coming back next year?
Well, apart from mooning in January.
Yep.
Yeah. But Northside Bazaar cannot wait. I mean, it's time, and we have a few things up our sleeves for that. So, yeah. Not going to say any more on that one.
We're keeping it hush-hush, everyone. You've got to stick to the Thorne Harbour socials for more info. Now, it is wonderful to have opened up, but one of the things I loved about the first week when the Laird reopened is you all decided we're just going to take it a little bit easy. And you were going to have a big, on Melbourne Cup Day, we're going to open till all night, and then you just closed a little early. And we're like, you know what, everyone, we're tired. I kind of love that, everyone's stepping back into this. I mean, we've gone through how many reopenings and reclosings and locking, and isn't it nice to just step back in and take our time with it all?
Oh, it was amazing because it was much needed. We'd had the craziest Sunday. It was our first Sunday back, and most people would know what our Sundays are like. To get through
glug.
Yes, and then to get to responsibly and to get through to Tuesday, that horse thing happened, and a couple of hours after that, we were just like, all of our staff, we looked at them and they were just not broken, but they were just like, this is a big thing, getting used to coming back and working with so many people. So we just closed a bit earlier, and everybody was cool about it. Because they knew that we're still here. Yeah,
and that's kind of cool. Now, business and community and everything like that aside, forget all of us. What about you? What are you looking forward to now that we're back out and about? Is it going for a swim? Is it playing with your dog? Is it dinner with your mates? What are you looking forward to?
It's all of the above. Swimming is awesome because I actually got to go to the Fitzroy pool last week. It was amazing. Doing all of those things. But also, you know what? There's times where you go, I want to be back on the couch again. So it's just like, okay, I can't do too much at once. So, but yeah, there is a lot of things, and just planning trips, seeing family, doing all of that sort of stuff.
I'm looking forward to not seeing my family because I see enough of them, and I can't wait to spend Christmas alone, just eating food. No, it's going to be... Look, Brett, thank you so much. Thank you for my artwork as well.
Yeah.
I'm going to take this. I appreciate you talking to me. You go and put your feet up or go and have a swim.
Cheers.
Thank you, Bretty. Oh, well, you know what? I think everyone's touched on some really important and wonderful things because as we step out, I reckon it's very important for us all to remember how difficult it's all been. The past, by the way, if you haven't seen this beautiful artwork, it's been repainted. Now it was Spenceroni's artwork. And now it's been repainted to this fabulous Aboriginal Lives Matter artwork here in Collingwood, which I think is absolutely fantastic and beautiful. And as this has been repainted and reworked, it's just reminded me to step out again and remember so much about community, so much about what I need to do and to look after myself as well. So we're going to throw back to you at the Thorne Harbour AGM, but I just want to say, everyone, don't be afraid to take it easy. Enjoy yourselves, enjoy reconnecting with your friends, with your family, and go out and have fun, but take it easy and get on that couch, because that's what I'm certainly going to be doing, because Midsummer's just around the corner and it's my 16th year and I'm going to have a big bang of a time. So we'll see you all this summer, having a wonderful time with all the community. Bye!
Thank you to Dean, and right now we have our final awards and our life memberships to hand out. Let's see who they're going to.
Hi, I'm Janet Jukes and I'm the President of Thorne Harbour Health, and it's my honour today to present the President's Award, which is awarded by the current President in recognition of an individual or a group in any field of endeavour that has had a positive impact on the organisation. This may include one-offs, significant events or individuals. The recipient is an individual or group that reflects or is closely aligned to the values of the organisation. It's my honour today to present the President's Award to Dr. Michelle Telfer. Associate Professor Michelle Telfer is a paediatrician and adolescent medicine physician. She's currently the Director of the Department of Adolescent Medicine at the Royal Children's Hospital and is Director of its Gender Service. Michelle was central to the achievement of federal legal reform with trans and gender diverse young people now being able to access hormone and surgical treatment without the need for approval by the Family Court of Australia. She's also a lead author of the Australian Standards of Care and Treatment Guidelines for Trans, Gender Diverse Children and Adolescents. Michelle's worked closely with Thorne Harbour Health, particularly Equinox and our transgender services. Michelle has borne much of the brunt of the continued campaign against the trans community and has supported Thorne Harbour Health also through this. There was a ruling early this year by the Australian Press Council that News Corp had treated her unfairly. Despite the continued attacks upon her, Michelle has continued to advocate publicly and strongly for the rights of trans people. Michelle's work supports Thorne Harbour Health's vision of a healthy future for all of our sex, sexuality and gender diverse communities, where all people live with dignity and well-being. She embodies the values of courage, inclusion, justice and leadership, and I'm so excited to be able to present this award today.
Hello, my name is Dr. Michelle Telfer and I'm a paediatrician and adolescent medicine physician, and I work at the Royal Children's Hospital here in Melbourne. I look after children, young people and their families, for those who identify as trans and gender diverse. I've been doing this work for nearly 10 years now in this current role, and I absolutely love meeting the new children, the new young people. Hello.
Hello. I'm Janet Dukes, I'm the President, and I'm here to award you our President's Award.
Oh my God.
Which is the highest award that we have in this
Oh my gosh.
People who embody our values, which you do.
Oh, I don't know what to say.
Take this.
Thank you. Oh my gosh, I feel so honoured. That's a big surprise. Thank you, Janet.
You well and truly deserve it. You've been taking a lot of flack for us in our community. And one of our values is courage, so you've certainly shown it in spades, so congratulations.
Makes me feel so proud. Thank you. Thank you.
Thank you.
Now, that's not red, is it? Is it just reflecting my... Oh, no, it is. Oh, it's fantastic. Oh, my God. I am like the best accessorizer of all time. The President's Award. I really don't know what to say because it's so unexpected, and I really, I really feel overwhelmed actually to receive this. I would like to thank the Royal Children's Hospital for supporting the work of the RCH Gender Service. We have seen an incredible number of children and young people, especially over the last year or two, that have so desperately needed our care and our help, and it makes me so proud to not just look after them and not just proud to meet these families and to be part of their lives, but proud to be recognised as making a difference. And if there's anything that I aspire to, it is to be always courageous and thoughtful and kind, and this means a lot. Thank you.
Hi, my name's Alex Friday. I'm Greg's sister, and this is our dad, David. Just over 6 years ago, Greg was taken from us in the Germanwings plane crash in France, along with my mum and 148 others. Following Greg's death, we learnt the depth of his life and all that he was able to accomplish in his 29 short years. I can only imagine how much he would have accomplished had he not been taken that day. At the memorial that VAC held shortly after Greg's death, our auntie Anne spoke of Greg. She said when Greg came out that he didn't ask himself what his community could do for him, but what he could do for his community. That's what led him to VAC. These words have often stuck with me as I often reflect on them, because this is how he lived his life and everything he did. Greg loved this organisation and left behind a legacy here. He did this with his willingness to help others and his connection and commitment to his community. He was an active participant of the work of VAC, and Dad and I are very proud, honoured and thankful to Thorne Harbour Health for the continued award for leadership in honour of Greg, to honour and reflect his leadership that he showed.
The Greg Friday Award is given to a young person in the Thorne Harbour community who has demonstrated the kind of collaborative leadership that was a characteristic of Greg's work and commitment to the organisation. The 2021 Greg Friday Award is being presented to Maxie Scher. Maxie became a volunteer in July 2020 to support the delivery of COVID-19 health information through app reach on gay hookup mobile apps. Maxie enthusiastically took on the role as an AppReach volunteer when there was a critical need for volunteers to take to the apps like Grindr and Scruff to provide information and answer questions community members had about sexual health and COVID-19, as restrictions were put into place for the first time. Maxie is a strong contributor to the AppReach team group chat and always provides generous feedback. Maxie is a team player and is central to team cohesion, being a pleasure to work with. He is always caring and happy, lifting the spirits of fellow volunteers and community he encounters. Maxie also volunteers in safe sex pack creation and events. Beyond Thorne Harbour Health, Maxie is a dedicated student who shows great passion and drive for helping others.
Hello, I'm Maxie and I'm a student who currently doing counselling. I'm joined the AppReach program a while ago and I'm volunteering for Thorne Harbour Health. I do really love this program because they provide like full training and a lot of useful information that we use in the AppReach program. I do this because that was like during the COVID-19 lockdown time, people were panicking and their sexual life get kind of disturbed. So I was, oh my God. Hi, hello, nice to meet you. Pretty good, thank you. How are you? What should we do?
Well, we're here today
Thank you.
to give you the Greg Friday Leadership Award.
Thank you.
And I'm Alex and this is David.
Hi Alex, hi David.
I'm Greg's sister and obviously our dad, so really excited to present you this award.
Who it is?
Oh, and this is my son Edward.
Thank you. Hi Edward. Thank
Here's
you.
the award.
Thank you.
Yeah, for all your amazing work.
Thank you. So should I just redo everything like what I did before?
Let's stop there.
Okay, cool.
Hello, my name is Paul Kidd and I'm a board member and a life member of Thorne Harbour Health. It's my delight and honour today to bestow life membership on Keith Stodden. Keith Stodden has been a member of Thorne Harbour since 1985, that's 36 years. Prior to being an active volunteer with what was then the Victorian AIDS Council, Keith was an early pioneer in the Victorian gay rights movement. He was involved in Society 5, the Victorian branch of Camp Inc, in its early days, including serving as its vice president. Keith has also been an active member of many LGBTIQ+ organisations, including the Also Foundation, the Australian Queer Archives, Vintage Men, Joy FM, the Gay and Lesbian Immigration Task Force, and many social and community groups, including the Metropolitan Community Church. Keith has made a significant number of donations to the Australian Queer Archives, and that's material that will be integral to how we understand our community's history for generations to come. He had a long career in immigration, supporting migrants to relocate to Australia, and was a well-known peace activist. Following the passage of marriage equality in Australia, Keith and his husband Glenn chose to formalise their relationship in 2018 by getting married. Unfortunately, Glenn is no longer with us, but he would no doubt be proud to see Keith's legacy acknowledged today. The Australian LGBTIQ+ community would not be where it is today without Keith's energy and pioneering spirit. We're also going to be presenting Keith with a hat and handbag, which is an old tradition of our organisation. In the rougher times of the HIV epidemic here in Victoria, when we were losing so many people, gay men resorted to any kind of humour, often black humour, to lighten the grief that we were all feeling. In an era when being a life member may not have meant you necessarily had the title for very long, a camp custom of making people have a laugh at life in a very gay way was appreciated. The tradition is that we present our life membership recipients with an exquisite hat and handbag, which they wear when receiving the award. I still have my very glamorous hat and handbag with me for the ceremony. It might strike some people as being a little bit passé, but there is something really great about celebrating a bit of campness and its role in historically helping our people get through difficult times. Good morning, Keith. Yeah, my name's Paul. I'm one of the board members of Thorne Harbour Health, used to be called the AIDS Council, and today I'm going to be a member of Thorne Harbour Health. We've decided to do this to recognise the fact that you've been a member of our organisation longer than practically anybody else. For 36 years, you've been a member of the AIDS Council, and you've been such an important person in the gay rights movement and the LGBTIQ community for such a long time that we're really, really proud to make you a life member today.
That's good.
Your nephew, I think, has the Life Member Award, and also maybe you don't.
Well, I'm trying to find somebody at reception. I'll come back in a moment.
We might have to have a rerun, but Keith, you'll receive a trophy, but also really importantly, you'll get a hat and a handbag. I'm also a life member of Thorne Harbour. I've got my hat here. I don't wear it very often, but I have a little matching handbag that I received when I became a life member. So it's something that you'll receive once we get it through to you, and it's just part of our camp tradition, and it's something maybe you'll have an opportunity to have some fun with.
I don't wear a hat very much.
Well, neither do I, but sometimes when you want to have a bit of fun.
I've just had the message that the manager here, Helen, who does a fantastic job here at Graceland Banner, is bringing it down to us now.
Okay. Well, we'll hold on for that to happen. I might take this off because it's way too small for my head.
Okay. So, look, on behalf of Keith and the family,
Thorne Harbour Health.
We are very proud of Keith and all of the work he's done for many organisations over a very long time. Yes. Okay. So, sorry about the delay at the start. Sorry about the connection issues. But Keith, you want to say any last words?
Overall, it's been a pleasure.
Thank you.
It's a sense that I've made a good use of my life.
Great.
That's beautiful. It's lovely to meet you, Keith, and congratulations.
Thanks very much.
Dr. Richard Moore has been working in HIV medicine for 30 years. He's a fierce advocate for our community, starting working in a Carlton practice that had the highest caseload of HIV patients in Victoria at the time, through to the Northside Clinic and working with patients there. He's been involved along the way in clinical trials to move from the days where there were very few options to the situation now where HIV is a manageable disease. He's passionately supported our community with a lot of energy and focus and vigour, and been critical in the lives of so many people who've been affected by HIV over the years. We're recognising him with this Lifetime Membership Award. He's actually been a member of Thorne Harbour since 1987. So congratulations, Dr. Richard Moore.
My name's Richard and I'm a doctor. Over the last 30 years, my career has been in general practice with a special interest in HIV and helping people living with HIV. My connection to Thorne Harbour goes back more than 30 years, way back when I heard someone speak from the Gay Men's Community Health Centre about the plight that people with HIV were facing, and that was what inspired me to get involved. Something you may not know about me is I have an interest in going sea kayaking with my friends and that's something I hope to be doing tomorrow if the weather is okay.
Hello, Dr. Moore.
Hi.
Hi. Now, I think you know you're winning an award here today, but what you may not know is that you've been awarded the highest accolade that Thorne Harbour Health gives to recognise contribution to the community. So we're presenting you with a Lifetime Membership Award.
Wow. Thank you very much. That's very special. Yeah, thank you very much.
Thank you, Parker. Now, there's a second part of the award, and this has a bit of a history back to the dark old days when we were looking at trying to create a bit of levity when things weren't so great.
Mm-hmm.
So an important part of the award is the handbag and the hat, which goes along with it.
Thank you very much. That's again very special. Do I have to? I should really, shouldn't I? Is that right? That's wonderful. Thank you.
Well done, Richard. Well done.
Wow. Thank you very much. Well, it's a great surprise, and I'm humbled. I've had an amazing career basically because of the people I've met through working in HIV. It's been a privilege working with all of them, patients and the other doctors and clinicians and therapists and volunteers involved in the whole area. It's like, as a doctor, it's still like no other disease. It always has been like no other disease. It's fascinating and interesting and scientifically enthralling, and it continues to be a challenge, and albeit with far better prospects for the patients than in the bad old days. Thank you again.
If you want, just hold it up a little higher, and if you want, you can say AGM Richard Moore, take 2, and then slam it.
AGM Richard Moore, take 2.
Slam. Harder, go again. There you go.
Thank you to everybody for joining us here today. We are at the end of our AGM production. We hope to see you all here in 2022. And to close out today's AGM, I'm handing over to a live performance by Mel.
I'm sick and tired of being swallowed like a rosary. I'll slow dance in the street with you, help out with the groceries. I'm sure I could love you better. I'm sick and tired of being swallowed like a rosary. I'll slow dance in the street with you, help out with the groceries. I'm sure I could love you better. I can never help but spill coffee on my overalls. I disappear from time to time, but babe, you know I'm jovial. And you, maybe you can teach me stillness. Sometimes I get so bored that I count up all my freckles. People think I'm difficult because I like to heckle, baby. Maybe I could teach you volume. I'm sick and tired of being swallowed like a rosary. I'll slow dance in the street with you, help out with the groceries. I'm sure I could love you better. I'm sick and tired of being swallowed like a rosary. I'll slow dance in the street with you, help out with the groceries. I'm sure I could love you better. You have no idea that in your eyes there lives a mountain. I don't mean to blow my trumpet, but girl, I'm a hell of a climb. I'll meet you there. Can you imagine the view? You're more than just a speck of dust inside a giant's eye, and it breaks my bones like dominoes every time I see you cry. Come closer, we're tangle legs just like we're supposed to. I'm sick and tired of being swallowed like a rosary. I'll slow dance in the street with you, help out with the groceries. I'm sure I could love you better. Sick and tired of being swallowed like a rosary. I'll slow dance in the street with you, help out with the groceries. I'm sure I could love you better. Better is subjective, so we'll change the word to different. I'll kiss you behind the knees until you know that you're significant. You are. Gotta know it. You gotta know it. Sick and tired of being swallowed like a rosary. I'll slow dance in the street with you, help out with the groceries. I'm sure I could love you better.
Thank you.